Hi, this is Just Be Well. I'm Tom Sult, a medical doctor and functional medicine practitioner. I want to talk about Lyme and the functional medicine approach. Anyone who has suffered from the long-term consequences of Lyme disease knows it can be a devastating and life-altering illness. What is Lyme disease? Lyme disease is an infection from the bacteria of the variety Borrelia. Several types of Borrelia can result in a clinical condition known as Lyme. Other Borrelia and other Spirochetes, which is the kind of bacteria Borrelia is, can cause similar infections. Acute Lyme disease is something everybody in the medical community agrees exists. It's a syndrome of fevers, sweats, joint pains, and fatigue. Of interest is that most people with acute Lyme disease seem to get over it without intervention. Others continue to be well and get tested and treated. Unfortunately, there's a lot of confusion surrounding even acute Lyme disease. Many doctors will see a patient who is worried about Lyme disease, who maybe even has a rash called an Erythema migrans, and tells the patients they'll order a test. The test returns negative and the patient is told they don't have Lyme disease. The problem is that when a patient first develops the rash, it's often too early for the test to be positive. The patient's Lyme goes untreated. In other cases, the patient never develops the typical acute symptoms of Lyme and is never considered for acute disease. The controversial part of Lyme is the chronic or persistent form. It is so controversial that even using the term chronic Lyme raises the ire of some doctors. Even among holistic doctors, antibiotics are often the mainstay of treatment for persistent forms of Lyme. And yet, even with years of antibiotics, many patients remain crippled with symptoms. Many theories try to explain how persistent forms of Lyme seem to have a poor response to antibiotics. They range from the long life cycle of the bacteria to antibiotic and different forms of the bacteria evading therapy to it not being related to an ongoing infection at all. And there is good reason to believe elements of all of these theories. Back to the notion that many people get over Lyme without even knowing they had it. They thought they had the summer flu. This is something that has been shown in many publications. That begs the question, how can we mobilize your defenses to rid you of Lyme? This is just one of the questions raised by functional medicine. Wellness is the optimal expression of your genes. At Just Be Well, we use the principles of functional medicine to help you express the very best version of yourself. We look at ATMs, antecedents, triggers, mediators. Antecedents are genetic factors, prior illnesses, injuries, habits, and other things that predispose you to illness. Triggers are those events that set in motion the aberrant biochemistry that results in illness, and mediators are the biochemical processes that keep you ill. Then we look at the 7 domains of physiologic function. Assimilation, how you get things into your body, whether it's oxygen or food. Defense and repair, your immune system, repair system, inflammation system. Energy, how you convert your food into energy for every biochemical process in your body. Detoxification, how you get rid of toxins. Communication, hormones, neurotransmitters, molecules of emotion, and other signaling molecules. And then structural integrity, everything from cells and intracellular membranes all the way up to muscles and bones. And then we look at mental, thinking, cognitive, memory, emotional, gratitude, love, anxiety, anger, and spiritual processes, that sense of purpose and place in the larger context of life and death. Studies have shown over and over again that mental patterns, emotional states, and spiritual connections have profound effects on our health. All of this is investigated using deep conversation, history, physical exam, and various laboratory tests and questionnaires. From here, we prioritize your 5 modifiable lifestyle factors: sleep and relaxation, exercise and movement, nutrition, stress management, and relationship. This builds a whole life intervention designed to express the very best version of you. This forms the foundation of treatment for any infirmity in functional medicine. We then layer on specific therapies for Lyme. These treatments can be to reduce symptoms so you can live your life more fully, or therapies directed at killing the bug or balancing other processes. I call this whole life therapy, not just Lyme therapy.